Welcome to today's video. Therapy can sometimes feel overwhelming, especially with the different types of licenses and therapists out there. In this video, I'll break it down for you so you feel confident in finding the right professional for your needs. I'm Kirsten, I'm a licensed therapist, and I own my own private practice. Let's get started. So, what exactly is a therapy license? A therapy license is a document that shows someone has met professional requirements to practice therapy. It's illegal to provide therapy without one, which is why it's so important to verify that your therapist is licensed. I also want to make it clear that a therapist is different from a coach. Therapists are licensed professionals with formal education in mental health, required to follow strict ethical standards. Coaches focus on personal development and goal setting, but are not licensed to treat mental health disorders. The law requires therapists to complete extensive education and training to earn their license, and once licensed, they must follow strict ethical guidelines and professional standards to maintain it. This ensures that you're getting this safe and quality care. In most cases, when you're researching therapists, the people you will find will have one of the licenses listed above. All of these licenses show that people have the training that they need to treat mental health conditions and to help people achieve their personal growth goals. To become a licensed therapist, there are several important steps. First, a therapist must complete a graduate degree in fields like psychology, social work, counseling, or something similar. This education provides the foundational knowledge and the skills needed to practice therapy. Next, therapists are required to gain hands-on experience through supervised clinical hours. This usually involves between 2,000 to 4,000 hours of working directly with clients under the guidance of an experienced therapist. After gaining this experience, therapists must pass a licensing exam. This exam tests their understanding of ethics, theory, and clinical practice. Once they pass, they can apply for a state license, which includes meeting any specific state requirements. Finally, maintaining that license involves ongoing education to stay up to date with new developments in the field and always following ethical guidelines. These steps ensure that licensed therapists are well trained and prepared to provide safe and effective care. Provisional licensure is a license granted to therapists who are still in the process of completing their required supervised clinical hours, however, completed all education requirements. This license allows them to start practicing under supervision while they continue to gain experience. By this point, provisional therapists have already completed their graduate degree and passed their initial licensing exam. However, they need more supervised hours to qualify for full licensure. There are usually a specific time frame for them to meet all the necessary requirements. During this period, supervision ensures that the therapist is practicing in a safe and ethical manner as they further develop their skills. Every board is different on how to become fully licensed. I can only speak on licensed social workers because I am one. You will know if someone has a provisional license if there is a G or an M in their licensing title. This stands for master's or graduate. For example, in social work, a provisional license will say LMSW or LGSW, but once you are fully licensed, you are LCSW and C. Lastly, it's important to keep in mind that every state is different when it comes to therapists practicing in solo practice. However, in most states, you will need to be fully licensed without supervision to run your own private practice. And here are some final thoughts. Therapy licenses help ensure that you are getting professional care from someone who follows ethical standards. With so many different types of therapists out there, it's important to find one that meets your unique needs. Don't be afraid to research and ask questions until you feel confident in your choice. Thanks for watching, and I hope this helped clarify any questions about therapy. If you have any questions that you would want covered, please leave them in the comments below.